allowing me to present today. What I'd like to talk to you about today is cervical cancer. This is one of the second leading cancer worldwide. In most parts of the world, it's the number one and number two cancer. In fact, there's about 2.7 billion women, according to the World Health Organization, that need screening. Now, it turns out that most of the world does not do screening. Something like 85% of the world barely screens. If you look at the two most populated countries that are also the fastest growing economies, China and India, you find they're number one and number two. Okay? And in fact, if you look at the percentage of screening in those countries, India only screens 2.6%. Okay, so basically, they're not screening their women. And China does not screen. Also, it's about 70%. So this is actually a real pride and shame for these countries that are trying to become really world leaders. They're not taking care of their women. And this is one of the largest cancer. Okay, so the market is actually quite large, as you can imagine. In the U.S., we spend over $12 billion a year. And but if you look at other parts of the world, what you have is growth opportunity. Not just in the developed countries, you have displacement opportunity, but worldwide you have growth opportunity. Okay, so if you look at the technology, and this is where I think Silicon Valley can play a role, is that we're using extremely old technology. The pap smear, which most people know about, is almost 100 years old. Okay, so you ask yourself, like, what technology do you use today that's 100 years old? Okay, not very much. If you then look at the next newest kid on the block, the HPV test, it's about 30 years old. And therefore, the performance actually reflects that. Okay, the first one, you actually miss half the lesions that require cancer. Okay, most women do not realize this. If you take the HPV, it's very sensitive, but it's very non-specific. I often use the analogy that if you're trying to catch Al-Qaeda agents, and because they're Muslims, you target all Muslims. Okay, I mean, it's obviously a silly analogy, but that's actually what we're doing in cervical cancer screening. So what you really need is really a new technology that can leapfrog the existing technology. And it turns out in the last about 10, 15 years, what we discovered is protein is the key. If you look at a protein, there's a protein that specifically is responsible for the cancer. If you detect that protein, you're actually detecting cancer. So we actually developed a technology to do this, and we rendered it into something extremely simple, a dipstick test. So it can be run anywhere. And the reason we did this is because our initial funding was by the Gates Foundation, and we wanted to service all the women in the world. Okay, so this has also, over the last several years, has been validated by a variety of third party, including the Gates Foundation, the Chinese Academy of Medical Sciences, the National Cancer Institute, the World Health Organization. So it's very well vetted technically. Now, just to give you an example of really what this can bring. In one of the studies in Ghana, they looked at 250 women. This is a pilot study, and all women had HPV positivity. They were infected by the virus, which is precursor to cancer. And what they find is, of the 250 women, about 7 were positive by our test. It turns out all 7 actually requires treatment. 6 were pre-cancers. 1 was a cancer. In fact, the only cancer in that cohort. If you look at that patient, what you find is the pap smear was normal. That's the first line of testing that's used worldwide. Okay, colposcopy, which is the next step, was indeterminate. Our test was positive. When they biopsied and took surgery, it turned out this is a stage 1A cancer. So if this woman were to reside in the U.S., she would have been told to come back in 3 years. Okay, in which case, that cancer, which is caught at stage 1A, will no longer be stage 1A. And her mortality or her survival goes from 90+% to about 15%. Okay, so we actually are having this technology used in a variety of settings, clinical trials, early adoption in many countries around the world. So just in summary then, what we believe, we have a technology that is a leapfrog technology. It performs better. It actually costs less. It's all the things that's good about it. And it addresses a multi-billion-dollar market that is both a replacement but also a growth market. Because again, most of the world is underserved. Okay, thank you very much.